Good evening, listeners, and a warm welcome to Views on Health. A great pleasure to have with me on the program today Dr. Manitha Perera, consultant physician, who I'm sure you recall was featured in this series of programs a few weeks ago. Welcome back to SLBC, Doctor.
Thank you, Fatima.
And for the information of our listeners, the topic being discussed today on the program is vitamin D deficiency. I think from a lay perspective, most people do take vitamins. We are called supplements and we are expected to take them for whatever reason. And some people feel good when they take them. The range of vitamins, whatever they are. I think I don't need to mention what they are, but focusing on vitamin D today, may I ask you, Doctor, for a start, to tell us what exactly is vitamin D? How does one get it? Through food, through other sources, supplements? Over to you.
All right. Thank you very much, Fatima. So, as you have correctly mentioned, there's a lot of interest on vitamins in general among all age groups. So, I think it's quite a timely topic. And out of all the vitamins, vitamin D deficiency or vitamin D and its deficiency and its health effects is a topic of interest of, current era. So I think it's very good that we talk about it. So vitamin D essentially is a vitamin which is essential for human life. So vitamin D is also known as the vitamin of well-being, and also it's also called sunshine vitamin. We'll get into that why it is called so. So it is essential vitamin in our body, and so it is an essential vitamin for us. And so the main way that we get vitamin D is actually through food and then through sunlight. So if we look at how sunlight helps us to, get vitamin, and this is exactly why it is called sunshine vitamin. So when the sunlight falls on our skin, the cholesterol compounds in our skin get converted to vitamin D through several steps. So this is actually free of charge. And we are in a country where there's plenty of sunlight, so there is no excuse for us to, not to get this source. So when the sunlight falls, as I mentioned, through several steps, it will get converted to vitamin D, and then this vitamin D will be stored in your liver. So your liver is a main store where your vitamin D, which is you receive from food or through your sunlight, is stored. And then when you need vitamin D for functioning, it needs to be further activated into activated form of vitamin D. And that particular process is usually, or by and large, is done by the kidney. So kidney is the one that converts whatever which is stored in the liver into the active vitamin D, which can be used for the biological processes. So that is a basic outline of natural synthesis of vitamin D. So you have to remember, then it involves your skin, it involves your liver, and then it involves your kidney. So any of the diseases that involves these organs can push you to vitamin D deficiency. So we'll get there as well. So in addition to this natural synthesis pathway, you can get this obviously from foods. So if you look at the foods, variety of food can give you vitamin D. So mainly if you look at fish, especially oily fish such as sardines, tuna, and then also beef, especially the liver component, and then mushrooms, egg yolk, and also cod liver oil. And then if you have gone through the common things that we buy in the supermarkets, some of the products are vitamin D fortified. So if you think you are deficient, you can look for fortified products as well. So these are the ways. So it is mainly natural synthesis through the skin, through the sunlight exposure. Then you can get it through, outside, through food consumption. And sometimes plant-based food can also give you. But the absorption, the bioavailability is more with, animal-based vitamin D sources. So either way, there are multiple ways we can get vitamin D into our body.
Thank you, Doctor. So what leads to the deficiency? The deficiency brings on what situations in a person's system? How do you know that this person is lacking vitamin D?
Yeah.
Whether naturally or maybe not even getting sufficient sunlight. As you say, we live in a country with a lot of sun. But on the other hand, not everybody wants to go in the sun. They think of being sunburnt. They're particular about their complexion, so they avoid that.
Yes.
Then they might use a sunblock. Then that means they don't get the natural sunlight into their system.
You're right. Yeah. So before we discuss how do we identify vitamin D deficiency, the symptoms, let's discuss what are its roles so that we know then what could be the symptoms. Right, so vitamin D, as I mentioned, is an essential vitamin for our body. So if you look at one of the most primary functions of vitamin D, which we knew from long time in medical field, is actually for bone health and muscle strength. So these are called skeletal benefits, musculoskeletal benefits. So essentially what happens is vitamin D, the active form of vitamin D, is necessary for you to absorb calcium and also to maintain these phosphates and other magnesiums in right amounts in your body. And these are essential minerals to maintain good bone health. So one primary role is maintaining adequate bone density and bone health. Secondly, muscle strength. These calciums and phosphates, when they are dipping, your muscles become weak. So again, muscle strength. So musculoskeletal benefits are immense benefits of or roles of vitamin D. Then for decades we knew about this, but then slowly over the past couple of decades, I would say, we have focused more into non-skeletal benefits or non-musculoskeletal benefits of vitamin D. And this is where it gets interesting. So now we know vitamin D is actually slightly beyond these musculoskeletal duties. So if you look at, I think during COVID, if listeners could remember the devastating pandemic, vitamin D came into picture because it is known to have an immune boosting effect. Now this, of course, you have to remember that this is still trialed and under investigation. So there are, evidence for and against both. But up to now, according to what we know that our immune system needs vitamin D for functioning. So in addition, vitamin D will provide immune boosting effect. So it helps to, immunity helps to prevent you from getting or catching infections. Similarly, you might have heard about certain conditions called autoimmune diseases. Now, autoimmune diseases in simpler terms is your immunity is misfiring. Its duty is to, attack the outsiders. It is misfiring and attacking your own tissues. For example, you have autoimmune diabetes, which is coming at young age. Autoimmune thyroid disease, for another instance, you can be having an underactive thyroid when it attacks your thyroid. So there are a couple of autoimmune diseases. There are neurological diseases. So it is found that vitamin D has an immune modulating effect in addition to boosting. So it can sort of help you to prevent these autoimmune diseases. Again, as I mentioned, these are in, investigational level, but it has been shown that there's a direction for positivity by vitamin D replacement in such conditions. And then also this altered immunity and things like that push you to cancers. So vitamin D deficiency is now currently trialed for prevention or at least reduce the severity of certain cancers. So again, as I mentioned, these are still being trialed, but these are new developments or new identifications of roles of vitamin D. And then also to heart health. It's a very interesting topic these days, especially in the Indian subcontinent. Heart diseases are quite common, and therefore vitamin D deficiency can help positively for your heart health. And finally, for your cognitive health, another important topic. We can go on to in deeper in that area, but let's keep it short. So it is important for your well-being, for your mood, as well as sometimes to keep your cognition intact in the longer term. So these are broadly, you have the skeletal benefits, which I think most of the lay people also know. And then there are an array of non-skeletal benefits, which are very important to maintain a good well-being.
So, Doctor, how does those deficiencies manifest? In the sense, end of the day, hopefully, there's a person or people who are not into any sort of supplements to boost the vitamin D that they need to have in their system. And maybe there'll come to a time when you might say, look, you need to be a supplement to help you to maintain the level you need to maintain to keep your system healthy. So what sort of signs are evident due to lack of vitamin D?
Yeah. So now that we know the roles of vitamin D, I think it will make more sense when we discuss the signs and symptoms. So first thing, out of the skeletal or musculoskeletal manifestations, when your vitamin D is dipping, you will feel weak. Your muscles will be weak. They will be achy. So you have non-specific pains in your body. Some people come and say, doctor, I have done a full body checkup, but I'm having these aches and pains which are going on. Everything else is normal. So you get aches and pains, bone pains, muscle pains when you are dipping in vitamin D. And also as your bones become thinner and more brittle, you are more prone to fractures. So you can, easily fracture yourself. You can have just a simple fall and end up with a major fracture. So your bones become more fracture prone. So those are broadly two main manifestations related to the well-known musculoskeletal effects of deficiency now. So then moving on to the other side of the story, people can catch a lot of infections because their immunity is low. So you can be pushed to infections. Not that vitamin D deficiency per se causes infections, but you will be more prone to infections because your immunity is weak. And then secondly, I told about the immune modulating effect, protection from autoimmunity. So there can be situations where you are pushed to. If you have a propensity to develop a autoimmune disease, you'll be even more likely when you are vitamin D deficient. Let me put it in that way, rather than telling vitamin D deficiency is the sole cause of it. So it's multifactorial, and vitamin D deficiency is one of them. So if you want to keep away from type 1 diabetes, certain thyroid abnormalities, so then it is important that you optimize your vitamin D so you can be pushed to these symptoms. And then, of course, your heart health will decline, and also your cognition, your mood. Sometimes it is known that vitamin D deficiency can be associated with depression. So to keep your mood and your brightness, vitamin D is essential. So that is another thing that you have to remember. Then also sometimes extreme fatigue. This is common among youngsters also these days. I also have few patients who come, sometimes with previously done checkups telling that they can't carry on during the day. Simply they have to stop because they're extremely fatigued. They feel like they have run a marathon. But when you check up the basic test for your hemoglobins, thyroid functions, all good. But when you check their vitamin D, they are quite vitamin D deficient. So again, remember, if you feel unduly fatigued, vitamin D deficiency could be the reason. So that is another way that a patient can present with. So skeletal manifestations, infections, mood changes, and then extreme fatigue. These are, few of the ways vitamin D deficiency can present.
Doctor, what sort of tests are conducted to detect that there's a deficiency? Is it a blood test?
Yes, it is a blood test, and it's quite a simple blood test to make the matters easy for both the physician and the patient. So before I move there, let me just tell how much of vitamin D is usually expected to be taken daily for different age groups. Now, the values, of course, as listeners, you don't have to buy heart. Just to get an idea about the increased requirements in certain ages and conditions, I will mention the minimum requirement. So this is a minimum. You can take a little bit extra than that. So anyone, up to about 1 year, so we are talking about the little kids, they need about 400 international units per day. And then throughout your adult life, up until about 70 years of age, you need about 600 international units per day. So slightly more if you can remember it that way. Then more than 70 years, you need about 800, again slightly more than the middle ages, because your bone health is declining at those ages with advanced ages. So you need a little bit of extra vitamin D support. And then pregnancy and lactation is an important physiological situation during female's life. Again, you need at least about 600 international units per day. So these are the minimum requirements as I mentioned. So you can have a little bit extra than that. There's no harm. This is the bare minimum that you need to be having. So then let's move on to investigating this. So how to diagnose vitamin D deficiency? So vitamin D deficiency, so whom to be checked? So anyone with the symptoms that we have discussed you can go to a doctor and the doctor will check, or if your doctor, as they consult you, if they feel that you suffer from these symptoms, the doctor will definitely order a vitamin D test. Then there are certain high-risk groups also. It would be incomplete if I don't mention them. So there are certain high-risk groups where we always keep an eye on them. Some of these high-risk groups, we being South Asians, we fall into that category anyway. For example, having a dark skin. So most of our complexion is dark because we are in the Indian subcontinent, and so it's difficult for the sunlight to penetrate our skin to the deeper layers. So dark skin, and then age more than 65, so slightly older population. And then people who wear protective clothes as a part of their culture, or as you said, some people naturally in our area, we don't like to get our complexion darker. So even after having sunlight, we might avoid sunlight, either way of umbrella or cloth or anything like that. So protective clothing hinders your ability to generate it naturally. Then obese people, again a common problem in this country. So obesity causes you to be at higher risk. And also if you have malabsorption, so if you have bowel diseases, which causes your vitamin D not to absorb, and also vitamin D is a fat soluble vitamin. So if you have any problem in your biliary pathways, which give fat for absorption, then you can be vitamin D deficient. Finally, if you have had a correction surgery for your obesity, bariatric surgery, that can also sometimes push you to vitamin D deficiency. So if you have symptoms, or if you have high risk features, or if you have extreme unexplained fatigue, you can get it checked. So the way to check that is a blood test. It's a simple blood test. You don't have to fast, no special preparations. You go, they bleed you from the front of your elbow as a usual simple blood test, and then you come back. And the results should be available within about 24 hours. So it's a simple blood test, very convenient, and then straight away it gives you the answer about your, level of vitamin D.
And assuming that the level is not enough, it's insufficient, then obviously you will have to prescribe some sort of supplement. Am I right? Or is it going to be any medication, doctor, depending on the person, the age?
Yeah. There are slight differences, but overall, as what you told, so once a deficiency is, confirmed, we need to replace it. That is an approach we take. So deficiency has two categories. So one is called insufficiency, other one is called deficiency. So this is the spectrum. Insufficiency is let me put it like a milder deficiency, and then deficiency means a category which we denote as severe deficiency. So it is a spectrum from little deficient to severely deficient. So your management approach will also slightly be different according to the severity of deficiency. Anyhow, now the common methods, or the more free and easy methods of correcting this still should be adopted. So if you are vitamin D deficient, irrespective of whether you are treated or not, you should now start encouraging to go out during the sunlight hours, maybe engage in exercise. So that is again good for muscles and bones and to reduce your weight, and you get the sunlight and you get the vitamin D through the natural sources. So that should be looked into. Secondly, your food. We spoke about the food which are rich in vitamin D, so you can consume a little bit extra from those type of foods. Then if you are just trying to maintain your vitamin D in healthy levels, of course you can take a vitamin D supplement. Some of the vitamin supplements that are commonly taken has vitamin D in it. So if someone is taking a vitamin supplement, a multivitamin, which a doctor has given, and it has vitamin D, no harm. You can continue that. Now, doing all of that, if you are proven to be vitamin D insufficient or vitamin D deficient in your blood test, then of course we specifically go for, a pharmacological replacement. So there, if you are deficient, that is, we are referring to the severe category. In that case, your doctor will initially give you a larger dose, which we call as loading. You might hear this term sometimes. The doctor is telling, I'm going to give you a larger dose, maybe as a weekly dose sometimes. We give, for example, 60,000 units per week or 50,000 units per week. Now, these values change according to patient. So these are not for, references. It's just to say that depending on your severity and your patient profile, your doctor will go for a larger dose. Some of these can be weekly doses initially. Yes, so then once your levels reach an optimal, sufficient level after initial large doses, then your doctor will put you on a maintenance, which is a relatively a lesser dose to be taken daily, so that you don't get pushed to, vitamin D deficiency back. So that is how you, replace pharmacologically. And similarly, I told you can be, deficient, but you are in the insufficiency range. That is, you are not severely deficient. Then your doctor might not go for, larger weekly doses initially. Straight away, put you on a dose that is sufficient to bring you back to the right levels. So then it is a daily dose to be taken orally. And after about 3 months, again, the levels will be done. And when the levels are sufficient, they will go for a long-term maintenance dosing. So that is how you pharmacologically, tackle this problem.
Is there a situation where a person will have too much of vitamin D in his or her system?
Yes, good question. So naturally also it can occur, and that is called hypervitaminosis D. That is too much concentration of vitamin D in the body. Now rarely this could happen due to certain diseases, but you can actually mess this up by taking unnecessary supplements also. But not to panic, because a lot of people are taking vitamin D over the counter, so these people need not panic, because the supplements are having only a small quantity of vitamin D, and taking a multivitamin with vitamin D won't push you to, this hypervitaminosis. But yes, if you take vitamin D larger doses unsupervised, that can cause you to have a higher or unnecessary levels of vitamin D in your system. And the symptoms will be quite nasty there. So you can have constipation, you can have again muscle weakness due to excess amount of vitamin D, then you can have kidney stones and calcification in the places where it is not necessary, like your organs, internal organs, and then also your mood again will get deranged when you have too much of it. So you can have even to the level of a psychosis. So yes, it is a therapeutic drug. So getting over-the-counter supplements in the, supplementary dose, yes, you don't have to panic. You can, have it. But then therapeutic doses unsupervised is not a good thing.
Doctor, time has caught up with us. So what is your take-home message?
Yes. So vitamin D, as I told, is a very essential vitamin. We spoke about, the roles of it. And therefore, you have to remember the two names that we discussed. It's called the well-being vitamin and sunshine vitamin. So it is essential for your well-being to keep you healthy, your immunity, your muscles and your bones healthy. And also it is sunshine vitamin. So you can get it mostly free of charge if you can engage yourself with some physical activity during the sunlight hours.
And on that note of advice, we end this interesting discussion on vitamin D deficiency. Thank you so much to Dr. Manitha Perera, consultant physician, for once again being with us on the program and sharing your expert knowledge on this very important topic. Thank you, Doctor.
Thank you very much.
Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razi Kader saying good night and looking forward to your company next Monday, same time on Views on Health.